for the kind introduction, Beth. IPPF is delighted to be unveiling our new pledge today, partly because it means we can do it at this important conference, but also because it's such an important time. As FP 2020's excellent recent performance report showed, we're slipping off track on our promises to the millions of women in the world who want access to contraception but don't have it. With the recent cutbacks in ODA and shifts to general health financing mechanisms that don't ring-fence family planning funding, we're seeing real pressure on essential areas. For example, the UNFPA's commodities program, which is so vital for national governments and civil society family planning. To put it bluntly, we're at a crossroads, and we'll risk our recent progress and the whole FP 2020 goal if we don't secure more resources for family planning, internationally and domestically, and if we don't improve the focus on quality and rights-based services. Melinda Gates' message and the other pledges earlier this week are a great start, and we hope other donors and national governments will follow suit. As has been proved time and time again at this conference, family planning is a brilliant investment. Being able to control when you start your family makes a tremendous difference to an adolescent girl's life, and it benefits countries too. When you increase a woman's ability to achieve her future plans, you increase her government's ability to achieve its future plans. And that's why the London Family Planning Summit called for bold action, and we agree. And in the few minutes I have, I'll briefly explain what IPPF has done, how we did it, and what we're going to do. So what have we achieved so far? Well, I'm pleased to announce that in 2014, we were able to achieve 5.4 million new users, an increase from the 4.9 million new users in 2013. Overall, from 2012 to 2014, IPPF has reached 15 million new users to family planning in FP 2020 priority countries. And the results are clear because after the London Family Planning Summit, instead of using surveys or estimates, we started on a new program with national associations worldwide to collect actual data on new users to family planning in all our service delivery points. And we don't mean new users to IPPF, we mean new users to family planning. We ask all clients, and we only count the clients who have never before received family planning. Delivering new users to family planning has a higher social return than simply getting new clients for your organization. And one of the advantages of collecting data from all the different clinics and service delivery points is it allows us to choose and invest in areas where we're able to reach more new users. The economic benefits from governments we've heard so much about this week mostly apply to first-time users. And development resources that fund someone to switch provider are less well targeted to development resources focused on new users for family planning. But I'm also pleased to say that we know that they are additional to IPPF, as our client base has increased by 40% over the same period. And that's really important given the FP 2020 target of 120 million is additional users, not new users. It also means we're continuing our services to existing clients as well as reaching new users. Our improved performance and expanded investment has allowed us to increase the family planning clients we serve whilst enhancing client focus. So how does IPPF reach that number of new users? Well, in the time I have, I'll focus just on three of them, the main reasons. Firstly, because of our scale. IPPF member associations, such as PPFA in the US, FJA in Ethiopia, Ranuma FPAP in Pakistan, FPASL in Sri Lanka, PPFN in Nigeria. They're big household names in their countries, and we're also serving just as high a proportion of the population in many of our smaller countries. The Federation works in 170 countries around the world, and in terms of FP 2020, we work in 59 of the 69 countries. We've provided 400 million services between 2012 and 14, of which half are for family planning. As the largest civil society service provider on sexual and reproductive health, we should be making a major contribution. But it isn't just size. Our ratio of new users over the last 2 years has also been exceptional, and which brings me to the second reason. It's because of what we do and who we focus on. As you might guess from our name, family planning has always been at the heart of what we do. But we've also set a new goal to drive performance, established a family planning catalytic fund, and improved data quality and client satisfaction. IPPF's focus is on those who have little or no access to services at the moment, particularly young people, marginalised groups, and those in crisis settings. A staggering 85% of our clients are from poor and underserved communities. Rather than mainly seeking clients for profit, our nationally owned member associations predominantly focus on reaching those who don't have any services. And IPPF has also overhauled our work on young clients. Over the last 10 years, we've moved from having 1 in 6 of our clients as young people to nearly 1 in 2 today. So focusing on these high-impact clients, it's easier to reach the new user numbers, especially given the third reason, the service we provide to individuals. Our rights-based approach guides IPPF's work, but it's not just the correct thing to do, it's the only effective thing to do to reach new users. If you want to reach new users, you need counselling that respects and informs the individual so that they can make their own decision. You also need to provide quality, stigma-free services in the right locations and to offer a broad method mix with short-acting methods alongside long-acting methods. The evidence is clear that more individual choice encourages new users. So that's how we did it, but what will we do now? Well, we're exceptionally proud of our performance since the London Family Planning Summit, and our efforts have led to real change and a major contribution. But it's not enough. All women who want access to family planning need to be able to get it. And with the global number going off track and the recent funding gains in danger, we need to act now, and FP 2020 has challenged us to do so. So as well as calling on all governments and donors to increase their investment, we've decided we need to go further too. Now, we've reached 15 million new users in 3 years, and I'm pleased to announce that we'll now commit to reaching 45 million in the next 6 years, meaning IPPF's pledge will become a total of 60 million new users between 2012 and 2020. This is ambitious, but achievable if we secure the targeted resources, and it will mean IPPF contributing a major portion of the global progress needed on family planning. We've all been inspired by the compelling evidence and the passion at this conference, but we've also been inspired by seeing fellow family planning supporters from over 150 countries, and the power that the family planning movement has when it comes together. So the final thing we wanted to say as IPPF is that we're all asked to pledge individually, but the dream of family planning and sexual and reproductive health and rights for all can only be realised as a movement, with FP 2020, UNFPA, supportive governments, other service providers, donors, academics, journalists. We make our new pledge very much as a contribution to this joint global effort. And if we all work together, we will not only change lives, we will change the future. Thank you.